Welcome to the pre-recorded panel session called Bringing Self-Care into the HIV Response, an AIDS 2020 satellite hosted by the Self-Care Trailblazer Group, Children's Investment Fund Foundation, PSI, the International Planned Parenthood Federation, PATH, FHI360, JPIGO, and AIDS Funds. My name is Benjamin Eveslage. I'll be your moderator for this 30-minute session, and I'll be joined by three panelists. So the Self-Care Trailblazer Group, SCTG, is a global coalition of partners dedicated to advancing the evidence, practice, learning, and policy landscape of self-care for sexual and reproductive health and rights. The SCTG promotes the adoption and implementation of the World Health Organization's consolidated guideline on self-care interventions for health, sexual and reproductive health and rights, as well as support the wider community in advancing self-care at the global, regional, national, and local levels. So a bit about myself. I'm the technical advisor for online HIV services at FHI360. At FHI360, I lead the Going Online portfolio, which supports our global and bilateral HIV projects to leverage online and mobile platforms to support their HIV outreach, service delivery, case management, and monitoring objectives. I was very pleased to join and moderate this panel because self-care is so integral to going online. I think going online can also provide a useful framework for our discussion today, because going online uses self-care approaches to broaden reach to previously unreached audiences, to better meet client preferences, and to provide targeted solutions for HIV services that are efficient and can be scaled. For more information on this going online approach, you can visit fhi360.org/goingonline. So I just wanted to highlight two figures from the Going Online vision that I think can be useful for framing our session today. The first, as you see here, helps us appreciate the diversity of HIV programs beneficiaries and the need to offer tailored solutions. Using this figure, you can see how target audiences can be segmented, including by the online and physical places where they can be reached. It demonstrates the importance of leveraging online and virtual channels to support self-care approaches. Next slide. This second figure is a practical example of how HIV programs can integrate self-care options at each step of the client flow. What this figure supports is a logical approach to plan an HIV service package to meet the preferences of the target audiences, including for clients who want or need more support and hand-holding. You can see those options on the left-hand side. And clients who want to be in the driver's seat of their own care. See those options on the right-hand side. So this extends from the very first engagement with a client through those outreach and marketing approaches to methods of linking clients to HIV services, and finally to the actual service sites and clinical services offered, which can be more or less aligned with self-care. Now, our session today will be a panel discussion format. I'll complete the intro very shortly after we introduce the panelists. Then I'll help keep time and present some guiding questions for our panel to discuss. We won't be using slides any longer, but we may reference some existing documents and links to related resources. Through this discussion, we plan to achieve the following. 1, help define self-care as it relates to HIV services. 2, discuss the importance of self-care for achieving epidemic control. And 3, we'll be following that with an exploration of related issues for integrating digital technology and new HIV service modalities for facilitating self-care. We'll conclude with a few closing remarks, and we'll show you the contact information for all the speakers in case you have any questions or comments. This session will complement the live session, which will have a more explicit focus on COVID's impact on self-care and lessons for the future of self-care and the HIV response. Next slide. So we have 3 expert panelists lined up who will help us explore this topic. Manjula Narasimhan is a scientist at the World Health Organization. Manjula leads the development and implementation of the WHO's normative guidance on self-care interventions for health, including for sexual and reproductive health. This is the first consolidated guideline published in 2019, and it can really help shift the public health community from a primarily biomedical disease perspective to a more human rights-based, people-focused approach. Next, we have Mohammed Majam. Mohammed is the head of medical technologies at Essentia, a subdivision of the WITS Reproductive Health and HIV Institute in Johannesburg, South Africa, and it's affiliated with the University of Witwatersrand. Mohammed is the technical lead for HIV self-testing in South Africa and has been instrumental on the STAR project, which has distributed close to 2.5 million HIV self-test kits. He's a member of the WHO's HIV self-testing technical working group and has led the work for pre-qualification of HIV self-tests and has provided independent assessments of 9 tests, many of which have achieved qualification. He has a keen interest in digital health and utilizing mHealth to improve linkage to care for HIV self-testers. Third, we have Samit Tandon. He leads the Blue Lotus Advisory, a partner agency on Accelerate, USAID's HIV/AIDS flagship initiative in India being implemented by Johns Hopkins University. Blue Lotus leads Accelerate's digital strategies such as development of online demand creation content and online sexual health platforms. Summit developed an MSM-only HIV prevention and management digital platform called Safe Masti, which translates to Safe Fun. And he also now supports the Yes For Me HIV service brand, which was the first of its kind in India to offer newly reached key populations online access to book discounted HIV tests at private labs across 15 cities in India, including home delivery and blood collection. So as you can see, our panelists bring a wealth of diverse experience. We'll get the intergovernmental perspective from Manjula, also a South African experience from Mohammed, and experience from an implementing partner agency in India from Summit. So let's get started. We have our panelists ready. Manjula, if you can help us get started, how would you define self-care and self-care interventions for health?
Hi, everyone, and thanks so much, Ben. This is great to be on this panel, and hi, everyone. So we at WHO, I know there's lots of different definitions out there, but the one we're using, and it's not a new one, it's one that, you know, has been on and off actually since the 1950s. We did a review of, you know, the number of times self-care and self-care interventions occurred in our various, you know, documents from that time. And the definition we're using now is really the ability of individuals, families, communities to promote health, prevent disease, maintain health, and cope with illness and disability with or without the support of a healthcare provider. So it's really quite broad in terms of what self-care can mean. What we mean by self-care interventions are really the tools that can support self-care. And so these are evidence-based. It could be information and medicines, it could be diagnostics, and other products and technologies that can be either fully in the realm of an individual use or linked to health provision within the context of a health setting. And again, therefore, with or without the direct supervision of a health worker. And we know that in different areas of health, whether we're talking about HIV self-testing, or when we're talking about self-injectable contraception or self-administration of other products, people use different languages depending on whether it's from a health system perspective, individual perspective, or specific health topic. But we're using the term self-care and self-care interventions as a chapeau sort of terminology for this.
Thank you. And what about more specifically related to the HIV response? What do you think self-care looks like for the HIV response?
So I think for the HIV response, we know that like the HIV self-testing, which we will be discussing, I think on this session quite in depth, it's really been something that's been at the forefront of this response for several years. And it provides individuals with that autonomy, the space, the confidentiality that they would need to get that test on their own, and even managing treatment on their own, or caring for when they're in the role of caregivers. All of these elements are important and form part of the self-care with the HIV response. The peer-to-peer support groups, these are all elements of whether you're self-carers or caregivers. It forms that the boundaries, I think, of what could be relevant for a response to the HIV. And we know that there are interventions that users have good knowledge of and that they feel comfortable using independently from the outset, and that there may be other interventions that need to be provided with more guidance and support before they can be accepted and used independently. And the HIV self-test is a great example of how it started within the health sector space and has moved to be sort of independently used. But the link to the health system and the support of a quality health system remains really important in the domain of self-care, so that we're not placing more burden, particularly on vulnerable populations.
Thank you. Let's shift over to Mohammed. So let's take a step back. What did you think when you started this work in South Africa, developing self-care oriented approaches? What did you think self-care should mean for the HIV response in South Africa? Maybe from the perspective of clients or patients.
Yeah, so from the South African perspective, and I think from a global perspective, it took a lot of advocacy to actually get HIV self-testing off the ground. I think there was, by 2015, there were only 3 countries, the US, the UK, and France, which had a policy around HIV self-testing. And so the biggest challenge was not so much selling it to the end user, but more trying to convince governments and national departments of health that, HIV self-testing has a place and there's an actual need to fulfill that first 90. So in terms of our HIV self-testing program, we looked at decentralized models for testing. Where are we getting to the individuals who are not accessing testing services? In South Africa in particular, we're looking at men of all ages who aren't accessing testing services, adolescent girls and young women, and key populations. So whenever we approached a distribution model through HIV self-testing, in the back of our minds, we were always looking at how do we access these target populations. Through the HIV self-testing program, we were able to access people through workplaces. And in workplaces, we focuses on male-dominated industries such as mining, construction, agriculture, petroleum. We try to get into large transport hubs because we know that we find young people and we find a lot of commuters on a day-to-day basis, making HIV self-tests available through private pharmacies and taking it into communities. So it's all about access. It's all about trying to make things simpler for the end user. And, with all the questions around HIV self-testing, around the support that's required, pre and post-test counseling, we needed to do a lot of work in terms of digital health and try to support the client on their journey from receiving an HIV self-test to actually getting linked to care for positive result and linked into prevention services for negative results.
Great. Apologies for the background noise, but I just wanted to appreciate your comments around how self-care is really helping to engage populations that have not been engaged very well in existing services. HIV self-testing is a great example that can sort of fit into places and contexts where traditional testing might not. And it also offers that access and simplicity for the end user. And you mentioned digital technologies. I wanted to switch over to Sumit's experience in India for this next question. So Sumit, how have digital and online platforms been critical enablers of self-care for HIV services? Sumit, I can't hear you. Can you unmute your microphone?
Sorry about that. We've tried 2 different approaches online, both virtual platforms. One of which, yes, for me, followed the approach of actually getting human interface to trigger self-care in HIV services. Literally imagine a sexual health worker tracking you on a dating app. When I say tracking, meaning following you, and actually bringing to you the concept of better care in terms of your own sexual health. And if you have taken risks, then to actually connect you to HIV services. This approach, we've done relatively well on this, which we've gone from what used to be potentially 10 new clients getting HIV tested at the start of the program to a year later to about 1,000 getting online. But to me, clearly comes with the caveat that if you look at the WHO model itself, self-awareness is still a very, very large challenge that needs to be taken care of before one can really start to rely on an individual's own ability to take care, or individual or family's ability to take care of themselves. On the other approach that we tried, which was Safe Masti, or loosely translates into Safe Fun, again, our prime target was actually folks who are potentially on dating apps as well. However, the approach structure was much more driven through awareness. So loads of awareness messaging via social media and so on, fun, relatable messages, and then leaving it up to the person to be able to choose whether they wanted to activate services or which we were connecting them to. The response, of course, was for every 100 people we reached, we probably got 3 or 4 interested in actually accessing service. Both approaches to me are absolutely essential and central, and both to me have so far caveated the fact that we do need to understand that self-care will require generation of awareness for it to be successful.
I mean, as you've probably seen also with new platforms that are launched online through digital technologies, they often come in the form of an app or a website that clients are engaging in themselves. They're able to access the website and find HIV services that are linked there. It takes a period of trust and awareness raising that and familiarity for them to be able to actually leverage those resources confidently themselves without a lot of hand holding. So when you're reaching new audiences online that haven't been reached by other services, and you're offering them these new self-care approaches through digital technologies, I think it makes sense for there to be some level of hand-holding at the beginning to bring that level of trust and familiarity with your new platform for clients to then uptake HIV services. Mohammed, did you have any similar or different experiences in South Africa?
Yeah, look, I think with mHealth and with digital health, there's certainly no one-size-fits-all solution. And what we've had to try and look at is, firstly, what type of community are you working in? What type of platform would be open to them? So we've developed a multitude of platforms for patients to use as a self-reporting tool of their result, or for assistance if they require assistance on how to do a test, where to go next once they've actually tested, where's the nearest service center, videos of how to do an actual test. So we've developed a WhatsApp for Business line with a chatbot that allows a patient to communicate the results and go through the various processes of the HIV self-test. We've developed a patient journey app, which is a lot more involved and that appeals more to younger people. And then we've developed an IVR interactive voice response system, which is a calling app, which allows people to call in and report the result. So yeah, I think the experience from our side is that, for HIV self-testing, digital tools all go hand in hand towards a complete self-care approach.
A very good point. I think both you and Samit had highlighted this, that self-care approaches do not mean necessarily that you put it in the hands of the client and then they can do everything. It's that you give them the tools to be able to reach out to support as well as they go through that journey of using HIV services. So very, very good point. And digital technologies can help clients do that. Reach out for support, helplines, WhatsApp support groups, etc. So that's a very interesting thing to mention. So I wanted to switch over to roadblocks and enablers at higher level policy or governmental levels that impact the adoption or scale up of self-care approaches. So as we know, the WHO is the lead technical agency in its normative guideline and has really significantly shifted the paradigm for supporting introduction of self-care interventions at the national levels. So Manjula, in this role, what elements do you think are relevant for the adoption of self-care interventions? What have you seen?
So you mean, so enablers and roadblocks, I guess, for, yes. So I think that, self-care, of course, and these interventions and tools that that's just been mentioned is just such a huge opportunity and is only going to be increasing in now and in the future. But I think we do need to keep in mind that for marginalized or vulnerable people, whether they're poor, indigenous, migrant populations, and others, who often lack access to quality health services. We need to be sure that these innovative strategies really do improve access and coverage and not add burden. And therefore, before recommending specific self-care interventions, it's important to have, firstly, the evidence that they're beneficial for health outcomes, they don't cause any harm or add burden to individuals, and really to make sure that, unsafe use of like unregulated or substandard products, incorrect or, unclear health information, lack of access to healthcare personnel if that's needed, or health facilities if that's needed, are really potential challenges that we need to tackle up front before rolling out the self-care interventions. And then, and we really need to address promoting, generating demand for these interventions within the context of sort of human rights and gender equality. And, currently one of the biggest challenges is ensuring that the products are available to those who need them, and that they do not place added financial burden on individuals. So these are, we've discussed some of the elements of what's needed for a safe and supportive enabling environment within the normative guidance. And although not all of these elements can be available everywhere, I think it's really relevant to make sure that we work towards establishing those standards, so that equity, human rights, gender equality, and the social determinants of health are central to the implementation of any of these self-care measures. And providing, and I'll repeat that, the safe and supportive enabling environment is really going to be essential for people who may neither be aware of their right to health nor be able to access the services that they need. And we don't, we want to improve coverage, and we can only do that if we address those challenges.
Thank you. This is same question for Mohammed. Any kind of enablers or roadblocks you've seen in South Africa for the introduction or scale up of the self-care approaches?
So I think we had a lot of battles to fight, and still today we still continue to do so. We're never going to be able to convince everyone that you can give a patient a test and expect them to go home and test themselves and link into care and do the right things. It comes from perhaps being an overly paternalistic society that we live in, where and a society in which we want to, ensure that we watch everything that people do. From a healthcare provider's perspective, this has been a very interesting one, where we found a lot of healthcare providers being roadblocks to gaining entry for HIV self-testing. When we did some qualitative work, we found some nurses saying, you're going to take away our jobs by having this HIV self-test in place. So, there's the barriers are come in all sorts of forms and sizes, from the community advisory boards, from politicians. So, we've fought many battles to get HIV self-testing rolled out. In South Africa today, 7 of the 9 provinces are rolling out self-testing. In 2 of the larger provinces, KwaZulu-Natal, which has probably the highest prevalence of HIV of any place in the world in certain areas, still today doesn't roll out HIV self-testing on the scale that is required. Same thing with the Western Cape, where we have a lot of townships. And then it comes down, in my opinion, purely to political will to make it happen. So, yeah, it's a difficult one to answer directly, but I think there's a continuous types of barriers that do come up.
Thank you. I wanted to also shift to client-focused considerations or challenges for uptake of self-care approaches. Samit, from your experience managing online HIV service booking website, Yes For Me in India, do you notice any challenges for clients to uptake your HIV self-care approaches?
Yes, absolutely. And I'd actually like to build on, I think, what both Mohammed and Manjula have been pointing out. which includes the fact that let me actually just give two illustrations of clients. One who was actually, I think, an 18 to 19-year-old young man who wanted to get tested because he thought he had some format of STD, but he wasn't sure at all. And all kinds of approach structures, from counseling to actually leading him to the nearest center that he could safely get tested, to actually offering home collection service for him, paying for it, which was a very, very big barrier from him. None of these were enough for him to feel confident enough to actually access service. We eventually literally had to have someone go over near his place and meet him close by, rather than actually enter his home or have him come to a center for him to be able to access the service. Huge barriers, and very difficult to scale a formula like that. And another approach structure where someone had actually tested positive and refused to act on it. Now, the big scare, I would say, in a self-care formulation is that if I've gotten tested and I do not have post-counseling, or my post-counseling isn't the kind that can ensure that I will actually sign up for a serious conversation in terms of what my treatment protocol is, that could create a completely different level of challenge, as it were. So I think, in a manner of speaking, as we introduce greater proximity or better access, we will discover newer challenges, and we will need to keep addressing them over a period of time. In the interest of time, I'll stop here.
Thank you, Samit. So we've been talking about challenges for clients and policy-related challenges at times. Let's also talk about opportunities. Manjula, do you see any opportunities for integrating HIV self-care approaches with other health services?
Yeah, no, absolutely. I mean, I think that the integration aspect is, it's an interesting question, because in the space of, self-care provides that opportunity to really provide those integrated services that we've been talking about for such a long time. Within the space of HIV, we've always talked about the linkages, for instance, between sexual and reproductive health and HIV, the family planning aspects in HIV. And here we find ourselves in a situation where you have the individuals, the communities, they can access those services that they need together, and they are actually leading those integrated healthcare, so they can access a condom with a HIV self-test, with a self-injectable contraception should they need it, an HPV self-sampling kit, or a pregnancy test, or the numerous other possibilities, the actual biomedical interventions, but other diagnostics, or we were talking about online availability of interventions and information. And so it really is providing tools for people to address multiple health needs together. And it's just remarkable, because we talk about these one-stop shops and these need for linking the actual health facilities, but here we have a new model, and a model that can only be beneficial to individuals if it's offered properly, and if the information and the products themselves are quality and evidence driven.
Thank you, Manjula. So we're running short on time. I'd just like to also mention that Samit and Mohammed, they lead self-care interventions and have integrated some forms of other health services into their approaches, and examples from Samit in India, who's actually integrated basic COVID-19 screening and self-management into their sexual health platform. We don't need to go into a ton of detail there, but it's showing that these things can work and show that they can become more valuable for clients by doing so. I wanted to end on one final question. It's sort of the elephant in the room. It's COVID-19. It's obviously lit a fire under many of us in the public health sector and has fast-tracked a whole range of self-care approaches. So I just want to end with a 10, 15-word response from each of us about what you think 2025 will look like as it relates to self-care. What progress do you expect, or challenges do you expect to continue seeing in 2025? Let's start with Manjula. You have the crystal ball. What does 2025 look like to you?
Oh wow, crystal ball. That's a tall order. So just in the interest of time, I think that you know, when we came up with the guidelines on self-care interventions, and WHO published this in 2019. Of course, nobody had expected COVID and self-care interventions to be placed really at the forefront of healthcare delivery. And whether we're talking about physical distancing, hand washing, all these other elements of self-care, and the actual self-care interventions that are now more and more available. I think looking forward, this is not going to go away. This is we're going to be in a post-COVID scenario, but we're going to be in a situation where delivery through telemedicine, delivery of self-care interventions and self-care approaches are only going to be increasing, and as it should, because this is a real opportunity to improve quality coverage for all.
Thank you. Crystal ball over to Mohammed.
Yeah, I wish we had a crystal ball. I think what we can see is that in the era of COVID, self-care has come to the fore, and the need for self-care has been exacerbated manifold. The need for behavior change has been exacerbated manifold, and I think the entire healthcare sector is going to move in that direction of having more and more of these initiatives where we don't have to get people going to clinics and facilities where we can take the people to take their health into their own hands.
Thanks. Samit, we'll end with you.
To me, I think digital is going to definitively get a step jump with COVID-19 response. It already has. And therefore, if one were to jump ahead for the next 4 to 5 years, we may potentially find a system of self-care where I am more enabled as a user to be able to not just access primary health advisory, infectious disease control, but also solutioning via digital, much more significantly than before, lightening up the load on the health system, particularly in systems such as India, which are overburdened and frankly under capacity, and being able to deliver better quality of infectious disease control of all formats without at all overriding privacy, which has been historically a challenge with digital. I think all of those will come together, and potentially digital will also overcome the barrier that quite often the medical fraternity offers. The notion of primacy of the medical professional in-person engagement will also need to see a shift, I think, quite rapidly. So I see a massive shift in 5 years where we're going to be self-caring a lot more, push and pull on digital.
Thank you, Samit. And I want to just thank all 3 panelists, Mohammed, Manjula, and Samit, for all of your thoughts and exploration of these related issues to self-care. We can go to the next slide. I'd just like to also highlight that we'll be having a live session on Thursday, July 9th from 9 to 9:45 a.m. Eastern Daylight Time. It's focused on HIV, self-care, and COVID-19. So this is a perfect transition to that next sessions, and it'll be focusing on lessons for the future of the HIV response. In this dynamic interactive session, we will explore how different self-care interventions and adaptations have become a critical answer in the health system response to COVID-19 and the potential to transform the HIV response. So go to the next slide. Please, you can also contact any of us with these email addresses here with questions or comments you have on this panel or the topics that were presented. Feel free to email us. Thank you all for your time, and we look forward to welcoming you to the live session on July 9th. Thank you so much, and enjoy the AIDS 2020 conference.